No, mic is on.
Is it now? Yeah, okay. Well, by the time we had our break, e-health has changed to m-health now because technology moves fast. And
休憩
whether,
の間でもう e ヘルスから M ヘルスにも変えました。技術が早いからね。
well, whether it is good or bad, we'll check now. My presentation is about the few changes and developments that have actually happened since I made my last presentation. And the first thing that has changed is probably the topic. It's now become m-health for rural India at sub-center level, and I'm still doing a feasibility report.
Give me a moment. Okay. 今回の発表は、前回の発表から移行の、移行と変更の話です。でまずは、E ヘルスから M ヘルスにも書いて、for rural India と、sub-center level の feasibility report で、sub-center ということは、これがインドの、ヘルス、関係の専門用語ですので、後で説明が出ると思います。
The reason is to do a feasibility report for the whole rural health system was a bit too big, and you can see here the Indian health system, and it's fairly simple. You have the top tertiary level, like state headquarter hospitals, and then you have the district level hospitals. And if you go more rural, you have the community level health centers, primary health centers, sub-centers, and then health workers. And my report basically tries to figure out a mobile health system for people at sub-center level and below. And if I would actually start looking up a little bit, the primary health center, community health center is a lot more complex. So I'm kind of starting at the very grassroots level. And so I'm kind of focusing on sub-center and below in rural health India. So that's basically a little bit of change, maybe a little bit of focus in my feasibility report.
図で見るとさっきの話は多分分かりやすいと思いますが、もともと Rural Health で考えたんですけど、Rural Health System でも結構幅広くて、もともと上には関係なかったんだけど、よく見ればこの辺もう結構複雑だし、もうちょっと、集中すれば、この Sub-Health Center Level、Community Health Level に集中すると考えています。
Well, the team is still the same. Me, it's Dr. Suresh. I have my teammates back in India, and they work for this project, and they contribute in many ways. Dr. Ajita, who brings together all the material, Mr. Sandil, who is the design guy with regard to this project. There is a mobile telephone guy with Mr. Arwin and Ms. Priyadarshini, who takes care of the project management. So that's my team, and it hasn't actually changed.
前のチームと紹介しましたインドにいる方と東京にもいる方、医療関係の人とあと技術関係もいます。
When I did my presentation last time, basically this project or this, the work here would probably be, ending in a feasibility report, a written report basically, and then there would be a kind of a virtual design for a rural health system to be applied at sub-center level and below. So that has basically not changed, and I'm still doing a feasibility report. I'm just kind of still confirming that I'm doing it. And
今回のプロジェクトの最終目的は、フィージビリティスタディとして、そしてバーチュアルシステム、実際のシステムはもちろんこのプロジェクト内で不可能ですので。
Yeah, and it will be presented in two ways, as a written report, and for better understanding, I'm planning to do an animation-based documentary so that a lot more people can actually understand better, because in public health and in M-Health, there are a lot of people involved. Technicians are involved, software professionals are involved, people at ground level are involved, and then healthcare professionals are involved. And so I'm kind of trying to make this information as accessible and as simple as possible.
だから報告書ももちろんですけど、その上にはこのプロジェクトは幅広い、専門の人が入っている。医療の人は医療関係の方がもちろん医療が分かるんですけど、あと技術の方が、その今モバイルシステムが分かるんだけど、みんなが全体このシステムが分かりやすく、理解できるためには、もうビジュアルな映像のドキュメンタリーも作る予定です。
And to write a report or to kind of bring out this idea of mHealth, we basically started with a very simple thing. Let's design a visual that explains what mobile health is, what is the applications of mobile health. And there were like two teams, one in Germany and one in India, working on different ways to express mobile health. And it's kind of rather simple. But the fact is that there is no definition, accepted definition for either e-health, for mHealth, or for telemedicine. It's kind of only a working definition. Anything that uses whatever it is telemedicine. Anything that involves electronics is electronic health. Anything that involves mobile communication devices is mHealth. So there's no accepted definition. And we try to kind of do things in different ways. First, we came out with this sort of a mobile-based web, and then with the world, whatever it is. So it just went through a lot of process, and then it got a lot simpler. And finally, we decided that this would be the kind of image that projects at least what we think mHealth is. And let me just explain this image a little bit. It's kind of a little bit. Okay.
Give me one moment here.
Okay.
このプロジェクト全体の目的のイメージを簡単に伝えられるためには、これがe-health プロジェクトであるか、mHealth プロジェクトであるか、テレメディシンのプロジェクト、いろんな、分野で多少違うと重なっている分野もあります。でも定義が、e-health の定義、mHealth の定義とか、実はないんですので、それを簡単にみんなにユーザーに何を作ろうとしているをイメージとロゴと多分スローガンも出ると思います。
And finally, we kind of thought this is something that explains mobile health very clearly, or at least to us. We put the mobile phone in the middle of this, and this one represents more like a nucleus, and the heart surround it is basically good health that is spread by the mobile phone, and it kind of symbolizes the atomic structure here. Small in size, but then with huge benefits and kind of very common across the world. So this is what we decided as what mHealth is. Very small in size, kind of universally similar, and capable of delivering a big effect.
じゃあイメージとしては、電子のストラクチャー考えて、で中核には、モバイル、機械装置があって、でも小さいシステムなのに、力が大きくて、そういう考え方です。
And this is just a different color. It looks better. But with regard to the report, there was a much bigger discussion going on, and many again suggested that we should basically start with defining what mHealth is. And because even that is not defined, we found a lot of scope to actually even come out with a rather good and convincing definition for mobile health. The discussion was basically two things. First is like if we are going to just say mobile health or mHealth is based on mobile communication devices, what happens if cloud health comes in, a cloud-based system comes in? And so if we just keep on changing definitions, then where are we going to end? So we kind of decided that, there is a kind of overlap here, e-health, telehealth, mHealth, and maybe even cloud health. But we thought we should define healthcare as a more functional aspect. Before this electronics came in, healthcare was fixed. People went to healthcare, people went to hospitals, people went to doctors, people went to whatever.
Yeah. じゃあ最初はチーム内ではmHealth の定義をしましょうと考えた。だけど、 あまりにも定義が狭いと、今後 M ヘルスも進化する多分はね、もうクラウドヘルスになる可能性もあるし、ですので、じゃあもうちょっと、もうちょっと狭い、ところに集中して考えてまして、in the beginning there was, I think,
Telehealth, maybe,
yeah.
or just
No,
paper-based health.
mobile. No, go ahead, continue.
Okay. Earlier, we basically went to doctors. I mean, we still go to doctors, and we went to hospitals or healthcare centers. So it's kind of a one-way movement where patients go to health system. And what we thought is with the mobile health, or even with the next step of cloud health, healthcare is actually coming to the patients, not the whole healthcare system. But even healthcare is administered at different levels: primary level, secondary level, tertiary level. If we just think healthcare as three different structures, we find that with the mHealth, things are actually moving from one level to another. The primary healthcare is coming to the homes. Secondary healthcare is coming to the primary health system. And tertiary healthcare, if you are going to implement mobile health systems, then it actually moves to the secondary health level. So we are thinking about an operational definition here. Healthcare actually moving towards the patient, and that is what we think is mHealth.
定義として最終的には考えたのは、医療に対して M ヘルスは何するか、全体的に、従来の、やり方が変わりました。前は患者さんが絶対病院まで行かなきゃいけないんだけど、M ヘルスによって、医療機関が患者までもうちょっと近づくことになる。さっき言った primary, secondary, tertiary とのケアがある。primary は何？近所 Is that your neighborhood clinic?
Yes, yes.
だからprimary は一番近くの、日本はクリニックの言葉あんまり使わないけど、近所の病院。でそして大きい病院、そういう、大きい施設、どんどん大きくなるんだけど、今の M ヘルスでは、一段を近づく。将来にはもうちょっと家までに何でもできる。家ではパソコンで何でもできるかもしれないけど、これが今の M ヘルスは、医療が患者に来ることになります。
Yeah. And the differences are more clear in developing countries because we didn't have this confusion of e-health, telehealth, or whatever it is. We just had paper-based healthcare where people actually went to healthcare. And now with this mobile health, we can actually reverse the trend and bring healthcare closer to patients. And if you actually look at this, if we take this definition as the benchmark, then we could shift all the sub-center healthcare services to the person into their homes. We can bring primary health center level services to the sub-center. We could shift district or even community health center facilities to the primary health center. And at the end, we could shift what is the tertiary level facilities to the district headquarters. So that is what we visualize mHealth can actually do to the society.
さっき説明した通りには、この各ステップが、ここが患者さんのところですので、全部もう一段より近いところに、患者さんに近いところに届けることできます。
And if we have to design a system which delivers basically sub-center level to the homes or primary health center to the sub-center level, then we just need to analyze what are the facilities that are happening there and then come out with a system that addresses all these functions. And that is what our report is going to be.
で、プロジェクトでは各 Can you back up one more time?
Okay.
各レベルにはどんな機能が入っていると。その機能を分析して自分作っている M ヘルスシステムの中でそういう機能がもう一歩一段近づけるようにできるシステムをデザインしています。
Okay. So our study basically has three sections. First section analyzes what exactly is rural health system in India, sub-center, primary center level. And then the next step is basically analyzing what are the existing capabilities of this mobile health system. What basically is a smart mobile what is how do we connect this mobile to the patient, what are the devices that are available. So we actually look at all these things. First we analyze what is the rural health system, what we next is we analyze this mobile system, and then we try to match these things. We try to match the functions that are expected in a rural health system with the functions that can be provided with a mobile health system, and see if there is a possibility of providing sub-center level facilities to the home and primary health level facilities at the sub-center.
These are the first two steps, right?
Yes.
全プロジェクトは、3つのステップに分けられて、第1は Rural Health System は何ですか、それを定義して、全体的分析して、で 2番は、そのシステムの中の、機能が、さっき言ったように各、機能が何がある、どうやってその各機能を、M ヘルスモバイルシステムの中に、入るかと。それはステップ2ですね。
Yes. And considering this whole study is hypothetical, we basically try to substantiate this whole exercise by giving real life examples on what is exactly happening in America, what is happening in rest of the developed world, and also what is happening in developing countries. We just try to match our hypothesis with reality.
ハイポテシスと、実際の世界が違うですので、自分が、ハイポテシス持っているんですけど、世界の中で、いろんな、実際事例をも分析して、それを、どんなことをこの、今考えているインドの M ヘルスシステム、持っていけるか、何が可能できるかと。
And finally, we would touch upon what would be the market for these M-health systems in India, because everything has to be funded and everything, when it goes into reality, needs money. So we would basically do a very simple analysis on what kind of market will it exist if this system needs to be put onto the ground.
そして市場分析と予算関係もあるし、インド政府に提案できるような、提供できる情報も集めて市場分析も行っています。
Well, in the next few slides, I would basically explain a little bit more in detail on what we are going to do in every step. The first step is what is M-Health, and that is basically what I described now. We are going to come out with a working definition for M-Health and see how it actually fits into this e-health, telehealth, or should it be taken out of all these things and should be treated as a standalone function. And also how it fits into the future development of a cloud-based health system. So we are going to cover all these things and come out with the operational definition of M-Health in our first chapter, which is what is M-Health.
繰り返しになりますけど、文書にもなっているんですね。M ヘルスの定義、何ですかと。それは他のテレヘルスと、E ヘルスと、あと、将来のクラウドヘルス、何の関係がある、どこに重なるか。
The next chapter would be on why do we need to develop a M-Health system in rural India? What exactly is the characteristics of Indian villages? Where do Indians live more? They live in rural areas. So, and also their socio-economic characteristics and existing health system in rural India, and how the ML system can actually change what is already happening. And also we look more closely into the rural population and see what specific needs they have got, what kind of diseases should be focused on, what kind of conditions should be focused on, and also what kind of funding structure is already existing that gives them basic healthcare that is already there. Who is actually funding healthcare structure already existing in India? So we are going to look at all these things and also see who is monitoring all these functions. So this would be our analyzing the rural health system in India.
次は、今のインドの Rural Health System の分析。それが、各、村に何がある、その人口密度とか、現在のヘルスケアどうなっている、で誰がそのシステムをコントロールしている、どんな病気が一番多い、どこに集中が必要、一番重要な、治療がどこですかとか、その、 分析。
In the next step, we are going to find out what basically is the need for designing a mHealth system in rural India. What are the gaps that the present system cannot actually address? Like, let's say there is a huge need for doctors in India. If we actually send doctors, they are not going to take up positions there because they have their own needs. They have families, their kids should be educated, they need access roads to go to hospitals. And are we going to even do all these things? Can we do all these things? So can the present system actually address the present needs? And how does mHealth system kind of override all these things and bring out a new system that basically addresses the health needs of the people?
で現在の、Rural Health System はどこまで今のニーズに、カバーされている。まずそれを分析して、そして、いろんな、対応してないところもあるかもしれない。予算問題もある、インフラストラクチャー足りないとか、今のシステムで。それを分かったら、じゃあ mHealth システムを作ったら、それをどこまで今のシステムと、協力できる、あるいは代替になるか、あるいは今、足りてないニーズをカバーできるか、そういう分析する予定です。
Well, the next thing we'll be looking at is who is actually running the rural health system in India? Who are the people who are part of the system? Who is deciding? Who is funding? And who are the healthcare professionals? Are they the doctors, the nurses, the technicians there, the village health workers? What are their functions and how do they actually deliver those functions? We'll look at all these things in our next chapter, which is dissecting the rural health system in India.
次のセクションは、今の、ヘルスシステムの管理となってますと。それは、政府と、今の、ヘルスインフラストラクチャー、そのステークホルダー誰ですか、各、それぐらいですね。はい。
And finally, we'll also look into how this health system is integrated into the next higher up level, which is the secondary health level system, and how this information actually goes to the national level systems, just the vertical integration.
次はその全体のインテグレーションどういうふうにつながっているか、さっきの図の段の中に各レベルがつながっている、ある程度政府がコントロールしているんだけど、各村から次のセカンダリーでターシアリーにどういうふうにつながっていると分析しています。
And once we have this information, we are going to look at what is this mobile health system. And this is what I mentioned. First, we'll have to find out what this mobile health system can actually do in the present day.
次、繰り返しだけど、どうやって mHealth システムはこの全体、今現在のシステムに、入る。どういうふうに入る。
And when we look at this mobile health system, we'll have to again dissect it into many ways. What exactly is a smart mobile system? We all keep talking about a mobile-based healthcare delivery system, but what exactly is a mobile health system, or which mobile can actually deliver this service? Can all mobiles deliver the service, or only particular type of mobiles deliver this service? So we'll actually look at what are the configurations of mobile phones can actually fit into what is a smart mobile. And also we'd look at certain basic things like the processing speed, the display characteristics, and also what kind of connectivity needs to be built into the mobile phone to make it work as a mobile health system.
で次は、そのハードウェアに関しての分析。どこまで単純な携帯電話あるいはスマートフォンレベルがどんなレベルのハードウェアが必要と、あと、ハードウェアとしては、容量とか、あと、通信容量とか全体的な分析、どんなものが、実際に応用できます。
To actually give an example, 2 weeks before I attended this SoftBank Mobile Health Service conference or something, and they found out that not all mobile phones can actually work in a mobile healthcare system because the display basically just doesn't fit into what is existing accepted standard, which basically means like although we think that we can actually see an x-ray or a CT picture on a mobile phone, the display is so poor that you cannot actually figure out what's wrong with the CT scan at all. So there needs to be some kind of standardization even with the display characteristics, with the processing speed, and on how you actually view healthcare information on a mobile phone.
具体的な事例としては、彼は2週間前、ソフトバンクの、
mobile healthcare conference
モバイルヘルスのコンファレンスがあって、そこでは、これからの、基準を作ろうとしています。モバイルとしてはどんな基準が必要と。一つの事例は、どこまでの、画像、例えば CT を見るため、どこまでの、画質度が必要、画面の上では。みんな今、きれいな電話持っていると思っているのに、それがもしかして医療レベルでは、その写真、CT を見ると、十分先生がわからない。何が問題か見ても、きれいな絵かもしれないけど、医療レベルではきれい、密度足りないかもしれないと。そういう分析も必要と、基準も必要。だからインドでもそのプラットフォーム、どんなプラットフォームが適切であると考えられます。
And once we are kind of come out with a sort of standardization for this, or at least a proposed standardization, we'll have to look on how to connect this mobile phone to the patient. Or rather, there are a lot of peripheral equipments like let's say an electronic stethoscope, ECG, glucose measuring device. So how do you connect all these things? Can this smart mobile actually connect to all those things? So this would be our next step. And on the other side, how do you actually connect this smart mobile to the database or to the next health level system like the secondary or the tertiary level system? So we will have to look at connectivity on both sides.
で次は、そういう機能的にはモバイルと患者に、接触側と、あとそれは、いろんなテストできるような装置がモバイルに、例えば、血糖値を判断するとかの、装置を使えるか、あるいはもうちょっといろんな単純な、装置が今、どんどん出来上がってますけど、それが患者サイドとの、接触と、でその逆サイドでは、モバイルから病院まで、あるいはそのさっきの段の次のシステムまでにはその、コネクションは、ね、どうやってつながる。
And once we have this hypothetical system, we will have to monitor it in two places. First is we have to monitor the people who are actually using the system. Are they actually working? Are they doing the kind of work that they are supposed to do, which is people monitoring? And then the next is data monitoring. Once these people actually enter the data, we'll also have to look at how the data is actually stored securely or whatever it is. So there needs to be two kinds of monitoring system that needs to be built into a healthcare system. First is people monitoring, and then the data monitoring.
Let me just clarify: is the data not for clinical purpose of data monitoring, but you said safety and security level?
Well, I mean, the data will be analyzed and used for clinical purposes. But basically, when we actually put healthcare workers on the ground, they need to be monitored first. Are they actually visiting the patients?
That was the second part.
Yeah, that was the first one, the people monitoring. Right. And when they actually enter the data onto the systems, then it has to be secured, it has to be stored, and again, it has to be analyzed at different levels. So that has to be monitored again.
じゃあ次の、分析は、このシステムがモニターできることは2つがあるわね。そのヘルスワーカーのことが、どんな作業がやってる、ちゃんとどこに移動しているとか、そのヘルスワーカーの、行動を、監視できます。でもう一つはその入力するヘルスワーカーが入力するデータが、次の、データベースに入ると、そのデータのセキュリティであるか安全性であるか、あと ちゃんと届けるところに届くシステムになっているかどうか。
And finally, we'll have to look at what are the regulations and policies that are already in place by the government, and what are they actually planning to do with probably changing these regulations to fit into the new developments, or is there any kind of areas which are absolutely no-go areas? And there are lots of areas like that in medicine.
で次のステップは規制環境の分析。現在の、インドの規制何がある、それ M ヘルスに関して、何が、関係するか関係しないか、あと今後の政府が考えている規制の変更に関して、どんなことがあると、あと規制見てからじゃあ何が、できると、あともう大切なことは何が絶対できないことは当然ある規制によって。
And finally, we are going to look at what is happening in the developed world and also in other developing countries. And basically, we are going to find out what exactly are the needs that they are being addressed in those places. And when you actually look at the needs and compare them to what is actually needed and is being developed to India, you find there are a lot of similarities. Like, let me give you an example. We are trying to move this healthcare service from sub-center level to what is happening to the people's homes. And this shift can actually be kind of carried over in many countries to even developed countries, or probably, I guess it doesn't matter where in the world. This shift can be actually shifted to many countries across the world. So we are kind of doing a needs assessment in different populations or in different types of countries to see if there are any common needs.
で次、いろんな国の、環境も見て、今インドの、Rural Health System と、他の国に似てる問題もあるだろうと、このシステムが違う、推進国 Is that right? No, developing 先進国ね。他の先進国にも、このシステム使えるだろうと。And did you say looking for ideas there, or
looking for basic needs?
Yeah,
what are the common needs?
だから似ている問題があればこのシステムはいろんな国で使えるでしょうと。
And finally, we are going to talk about the market for health systems. And in this category, we'll focus on who are the healthcare providers. In many countries, there are various healthcare providers. And in developing countries, primarily it is the government. But also there are private healthcare providers. And there are also various different types of services being provided by primary providers, private providers, and public health providers. So who is going to find this mHealth system useful, and for what purpose are they going to find this useful? So that would be our market analysis.
で次は、市場分析。ヘルスケアプロバイダーとしては、インドの場合ではほとんど政府になりますが、他の、市場では他の国では、違うところがプロバイダーでしょう。だからお金、こういうシステム、誰が買うと、誰が、どこに重量があると、お金どこから来るとの分析です。
Well, I kind of covered a lot of topics here, and I guess you could do an in-depth analysis on each one of the topic that I have mentioned, and there's still no kind of a clear way for most of the topics again that I have mentioned. But in this research project, we are going to keep things very simple here, and we are going to kind of come out with a rather brief description of each of this topic, and we are going to keep it limited to around 1,000 to 2,000 words on each topic. But we are going to focus on a schematic diagram, or rather a graphic representation on this whole idea, or rather on each idea, to visualize in a way that people can understand what is the benefits, what are the needs, and what is the future in each idea. So our focus would be on a schematic diagram here.
今までテーマいっぱいありましたと、それ各テーマは、 時間があればいっぱい分析でいっぱい時間取れますけど、自分の制限つけて各ところに、2、3ページぐらいの、報告して、あと、文章より、図面とかグラフとか、あと映像も作ります。
And our documentary would again have the same format where each topic would be covered in 3 to 5 minutes, mostly with regard to animations on how this process actually happens, with interviews or video footage in India on how this processes or how this new design is going to hopefully address the system there, existing system there.
で、あとドキュメンタリーも作ります。で、それは、各トピックが、書いた通りには、ナレーションもある、アニメーションとか映像で説明します。全体的に30分から45分ですね。
Well, this is an example on what is basically we are planning to do in the future. Once we have mapped out all the needs on rural population and what are the devices that are needed to actually deliver healthcare service, there is a possibility on integrating all these things into a mobile phone itself. And this one is actually existing in reality, but it's not used for a rural healthcare service. This is a new system that's being put onto airplanes. It's very new. It actually provides a glucometer, breath gas analysis, temperature, blood pressure, pulse oximetry, a ECG, and a real-time voice data service, and a photo and real-time video. If any person on a flight basically becomes sick, they connect this machine to him, and a doctor on the other side can actually talk to this guy, and using the basic diagnostic information from this equipment, he can tell the captain of the flight whether to land and transfer this person immediately to an emergency facility or to carry on with the flight. And this was introduced last year, and it's on maybe 2 or 3 airlines only now. But what we are planning to do is come out with some sort of a similar setup to be used in rural healthcare service, where a village nurse or a village health worker carries something like this, and he can get as much information as possible from the homes of the people and transfer it to the health system, where a diagnosis or the next step management can be possible.
これは実際にもう市場出てる、商品ですけど、自分の M ヘルス考えている M ヘルスシステムは、これは未来ですけど、これは、rural のためではなくて、飛行機内で使われる、非常システムです。でも、いろんな、テストできる、医療テスト出て、あと通信機能もあります。だから異常の場合では、病気になった、倒れた、方に、すぐ、テスティングとか、あと、病院とリアルタイムで連絡取って、どのぐらいこの方が、危ないですか、飛行機を、すぐもう、着陸必要かどうかとか、これもできてますので、似てるシステムを Rural Healthcare Worker にも、理想的にはこれぐらいだけど、最初はもちろんこんな複雑なものではないんですが、イメージとしては未来はこれがRural Healthcare Worker は持っていれば、いろんなサービスが、遠隔医療もできるし、すぐ患者まで、ほとんど、全体病院が患者まで届けると。
And as I mentioned before, you can now imagine that there are basically little differences between the needs of people in developing countries or in the homes of developed countries, because people are still people and they are basically more or less same. So if you actually visualize this, and if this kind of device is developed, depending on probably the purchasing power of people, either the government could actually put it in every village, or it could be put into every home in any place in the world.
世界では人間は人間ですので、 同じ医療を使えるんですけど、違うのは、みんなの予算とか豊かレベルですので、インドで考えれば、例えば各村でこれ一つが入れられる。もうちょっと豊かな国では各家にはこういうものを考えられるかもしれないよね。各世帯に考えられるとかだけど、未来ではこういうものが普及されるでしょうと。
Again, to summarize what I've been telling, first we are going to look at what is a mobile network, what is the configuration of a mobile phone that can actually work in this sort of a system. And then the next step, we are going to look at what are the peripherals, the electronic peripherals that needs to be linked to this mobile phone to actually work as a healthcare system. And then in the third step, we are going to look at the ecosystem, the rural ecosystem where this mobile phone plus the electronic peripherals need to be working. And finally, how to connect it to the people and how to connect it to the healthcare system at large. So these are the 4 steps that we are going to look into this project.
まとめとしては、真ん中に、モバイル装置があって、でそこに、周辺装置は何がつながることできるとか、テストできる血糖値テストする機が体温計とかいろんな装置つながることできると。あと最後はそのモバイル、プラットフォームモバイル装置をどうやって、全体の医療システムに、通信できる、つながることできる。
I guess by the end of November, on November 28th, I would be presenting a draft report on this, at least mostly written report on this project, and I'd probably also have a documentary scheme on what to do after I go back to India. In December and January, I guess I'll be in India to actually do photography, videography, interviews on how to get supporting information for this project, and hopefully that would be finishing by the end of January, and both the report and the documentary would be released in a forum here in February 2011.
でスケジュールとしてはここに書いてあります。11月月末今度の、報告、そしてインド2ヶ月ぐらいインドにいて、全体終了してで2月フォーラムで発表会できます。
Well, thank you for listening, and any questions, please.
どうもありがとうございました。それではちょっと時間過ぎてますけど、質疑応答せっかくですのでいたしますが、いかがでしょうか。
Thank you for your presentation. I have one question. Maybe I could not fully understand your system, so I was not sure what you actually intend to do with the mobile device. At one point you mentioned, for example, that screen resolution of present devices might not be sufficient. So at first I thought you would primarily use a mobile phone or mobile device to transfer data from a remote rural area to a higher infrastructure clinical center. But when you mentioned the point about insufficient screen resolution, so then I thought you would actually use the mobile phone or whatever you call it then as the diagnostic device. So I was not quite sure what is the primary goal. So will the mobile device be the actual diagnostic device, or will it be used to transfer data? Because for example, I could not imagine that there is a CT equipment somewhere in a small village located in India where you have to look at the CT image on a mobile device.
Thank you for the question. I guess so far, whatever mobile health research that's happening in most countries is focused on is a kind of a vertical research where they focus on a particular device or a particular kind of what you call a process like data transfer, or like let's say a video transfer, or maybe even like a picture transfer. What we are actually trying to do here is to see if this mobile phone can actually work in a system. And in a system, we are not only merely looking at identifying data. As I mentioned, we take a mobile phone and then try to link it to peripherals. And by meaning peripherals, like let's say an electronic thermometer. And in an electronic thermometer, we only get digital data, so that's not a problem. But information is of many types. If we are actually linking this mobile phone to an ultrasound probe, a mobile phone-based ultrasound probe is available on the market. And it is actually needed in rural areas for antenatal care. Three episodes of ultrasound is necessary to be taken. And that is actually done in a primary health center. And in a mobile health system, we are seeing if this can be shifted to the homes. Can this health worker take this mobile phone to the home, connect a probe, and use it as an ultrasound? If we are going to use that, will the screen resolution be enough? Of course, we are not going to see the shift the CT scan to the home, but at least an ultrasound can actually be shifted there. So in that case, can this screen actually do the job? Or do you definitely need a bigger screen or a better screen or whatever it is? So we are not exactly seeing what is a vertical system here. We are actually looking at the whole system, the whole types of data that are being generated. Digital, simple data like temperature, height, weight, and also a little bit more complex data like pictures, videos. And can all these data, all types of data, be what we call put onto the mobile phone? And that is what we are going to evaluate. Am I understanding?
You may have had is that you weren't here for the previous presentation, and he explained about the environment of the rural healthcare in India, and some very simple things like maternity, prematernal checkups. They should come to the hospital, but the women are not coming. So the healthcare workers go to the houses sometimes to visit them. And if they could do some of these simple tests at the home and then transfer the data back to the hospital, then they could solve some problems. So he explained that in the last one. But you're right. He's not really talking CTs, but that was just an example at the conference that you were at the SoftBank conference, right? But some more simple tests perhaps could be connected.
And the whole diagnosis in an ultrasound basically depends on your screen resolution. So there should be some kind of standardization. We can always start speaking that an iPad can be used, iPhone can be used, but is it good enough as your existing ultrasound? First, that question has to be answered.
Any other questions? No? No?
Thank you.
どうもありがとうございました。ですね、11月の28日に e ヘルス、それから先ほどの小田さんのですねプレゼンテーションを含めてフォーラムがあります。で、スレッシュさん、Dr. Suresh business model is a little bit more complicated than we expect, so we need more. So maybe November 28th, we should learn his business model. So the name is Suresh business model itself.
I mean, right now it's kind of called as M-Health for rural India.
M-Health, OK. ではですね、ちょっと時間が少し予定より遅れておりますので、休憩を次のセッションで取りますので、よろしいでしょうか。